Good evening. Welcome to WFUZ-TV, the People's Voice podcast. I'm Blair Castro, here with Thomas Jenkins, and today we have Mr. Clyde Jones in the studio with us today. He is a candidate for Alabama's 1st Congressional District in the general election, which is in November. Mr. Jones, thank you so much for coming in.
Thank you, too, for having me here. I appreciate the invitation. It's good to be here with you,
Yeah, so I want people to know, first of all, the race goes on until November. This special primary, August 11th, is not the end of it. There is still a general election that goes on. I think people kind of forget about that in the state of Alabama sometimes.
Yeah. So, absolutely. So, the Republicans have their primary. It would be a Democratic primary as well, but I don't have an opponent, right? So I don't have a primary opponent in the primary. So I will not be on the ballot, like you said, until November 3rd. So I'm excited to see who my opponent will be after next month, and looking forward to continue the campaign until November. So we're excited about that.
So it was reported that there was a pretty high blue turnout in this last election in, what was that? Was that the June or May election?
The May, I would think.
The May 19th. Yeah. Mm-hmm. And so does that give you a lot of confidence going into this election?
Yeah, it definitely gives me a lot of hope. I don't know, confidence might be a little too high, but it gives me hope that there's change along, in view, and that change is possible. So we're excited. I mean, everywhere we go, people are encouraged. People are excited, no matter which county. Of course, with the redrawing of the lines, I have all of Baldwin County, all of Mobile County, all of Escambia County, and most of Covington County, except the northeast corner of Covington County, up near where Oppie is. So,
how do you feel about that redrawing?
Well, I mean, I think the reason for the redrawing is really not good, right? It's trying to disenfranchise, trying to eliminate a Democratic representative seat in Congressman Figures. He is a great representative, by the way. He's done a great job. This is his first term. He's done an awesome job up there. But just to try to eliminate that, and you hear different people talk about different reasons why the lines were redrawn. But the fact that our state legislators rushed to Montgomery to redraw the lines because of that Supreme Court ruling, and to eliminate a district, or try to eliminate a district that is represented by a Democratic representative, is really disheartening, right? It's really disappointing that our state rushed to do that. Although it's disappointing, it's not really surprising, right? I mean, most southern states followed suit and did that. But what I think happened in the redistricting, it gave he and I both a golden opportunity to win this election coming up. So we have to turn out the vote to show them that redrawing the line doesn't change the things that they think is going to change.
It seems like this cycle is actually a fair opportunity for Democrats to trend higher in the polls, because what I'm seeing online right now with Tuberville being pro data centers, a lot of people turning to Doug Jones. We've had a Doug Jones sign pop up right across the street.
Yeah, I saw that, and I might stop by there, or Donna, you can stop by and knock on the door and say, "Hey, do you want a Clyde Jones sign beside it?" But yeah, I did see that. Right, I did see that. So, and you're right. I think a lot of people are not pro data center, and with Tommy Tuberville coming up on that stance, I think it only helps Doug Jones, and a lot of people. And I see Doug. I mean, as far as the enthusiasm in his travels around the state as well, there's a lot of support. So we'll see. We'll see what happens.
So can you tell us a little bit about why you felt compelled to run for Congress right now at this point in time, and what kind of motivated you to jump into politics?
Sure. So it's a long history, and I won't cover the entire thing, but I'm a 21-year military veteran. So I retired from the military actually 21 years ago now, right? Desert Storm veteran, Operation Iraqi Freedom veteran, Bronze Star recipient. So I have been a public servant pretty much all my life. I joined the military at 17 years old, retired at 38, turned 39 the same month I retired. Went to work for DuPont, which is a chemical company, right? So I got involved in that, and that's how I ended up in Mobile, working for DuPont. So I got involved in community service while I was working there. I'm a minister at my church, right, at Macedonian Missionary Baptist Church in Daphne. So I'm one of the associate ministers. So I've always been involved in community and trying to make the community better. So when I started working for DuPont, I started working in the nonprofit industry. I've been helping with United Way, helping with campaigns for that company. Also got me involved in working with Alabama Rise. So, and I'll talk more about them in a second. But during President Trump's first term, I was motivated to run for office here in Baldwin County. I was motivated to run for school board because I think our public schools are so important to our community, so important to essential to our growth, essential to the quality of life that we enjoy, right? So I decided to run for school board during the President Trump's first term. One thing about President Trump, it seems like he motivates me to do a little bit more, right? To go above and beyond what I normally would do. So I ran for school board the first term, did very well. People from across the aisle voted for me, did very well, but I didn't win. You know, kind of, and you understand that, you know, when you do well, it makes you feel good, you know, that you got involved and you did well. But I didn't win. But I stayed involved, right? I stayed involved because I knew the importance of having good representation for our community. So stayed involved every election cycle since. You know, someone would say, "Are you running for something?" But if you're working a full-time job, it is extremely difficult to run for office. You know, and you might know if you're working. I mean, it is hard. So when I retired, I took an early retirement in May of 2024 from DuPont, which is now FMC in Mobile. When that happened, I knew I was going to run for office again. Now, exactly at that point, I really didn't know. My first thought was state representative. I had been working with Alabama Rise. I don't know. Do you all know what Alabama Rise is?
Do not.
Nope.
So it's a statewide nonprofit that helps alleviate poverty in the state of Alabama, right? They work on Medicaid expansion. They work on reducing the grocery tax, right? You know, when we had that reduction in grocery tax, that's one of their main things that we're campaigning for to happen. So that was a big win for us at Alabama, right? Mm-hmm. So we're working on different policies. So that really got me motivated and encouraged to work at the state level in politics. So possibly run for state House of Representatives. So I had kind of made up my mind. I was like, you know what? All right, I'm retired now. I'm doing this Alabama Rise. I'm the board president. I'm involved in state politics. I think I'll run for state House of Representatives. Called a good friend of mine up in Tuscaloosa. I said, hey, I'm looking at running for state House of Representatives for my district, which is District 64, where I live in. And she was all excited. She said, yeah, that's great. That's great. I think that's a great idea. By the time I hung up the phone, within an hour, she had emailed me a draft announcing that I was going to run for office, run for state House of Representatives. So I was like, cool, let's do it. About a week later, she calls me back and said, I just got off the phone with some people at the national level in the Democratic Party. We really need you to run for U.S. Congress. Have you considered that? Certainly, it was not on my bingo card at the time. But I said, no, I hadn't considered it. But that's something I think I could do, right? So I said, let me talk to my boss, which is my wife, you know. So I had to talk to my boss and see what she thought about that whole subject. And that same day when she got home, I told her, I said, look, I've been asked to possibly think about running for U.S. Congress. What do you think? And without any discussion, she said, go for it. She didn't even want to talk about it. I said, you don't want to just like kicking around, talking? No, she said, that's you. You can do it. I know you can do it. So I talked to a few other people. That was like a Thursday. So on that on that following Monday, I called my friend back and said, I'm in. And that's kind of how I got to the point of actually running for U.S. Congress. And that's where how I got to that point. So, I don't know if that answered with you, but that's, kind of rundown of how I got to where I am right now. So, yeah.
So what qualities do you think you have that make you a better choice than the other candidates? I mean, just say it's probably going to be you and Jared Carl.
Yeah.
So why should people vote for you over, I guess the person who was our previous representative?
Right.
What do you think you bring to the table?
Well, I think I bring leadership because of my military service and the years that I spent in the military in my public service. I think I bring a level of compassion that we haven't seen in previous leaders here lately, right? So a level of courage, because it takes courage for a Democrat to step out, right? In the state of Alabama to run for office. So our politicians need a level of courage that they can stand up and not just fall in line because of a party, right? For me, when I get elected to Congress, I'm going to be the representative for everyone in Congressional District 1. I don't care if you voted for me, if you didn't vote for me. I don't care, what your background is. I will be your representative. So I'm up there beholden to your interests, not corporate interests. I don't take money from corporate PACs or anything like that. So I am beholden to the people's interests. So I know, and Jerry, I know he's quick to say, well, I have the experience. Well, I have to say we're experiencing his experience right now. So, and that's part of the reason we're in this affordability crisis right now. Part of the reason we're in this, the Iran war and everything. And my oldest son, let me put this out there. My oldest son is deployed to the Middle East right now. He's a major in the Army. So I have stock in the game. I feel like I have stock in the game when it comes to making those decisions about our sons and daughters that are serving in the military again. So I feel like I have a wealth of experience when it comes to leadership, when it comes to decision making, particularly in the military, on the military side of the house. Not just that, in the nonprofit world, right? Again, I've been working for the last 6 years, the last 2 years, being the president of the board of directors, working on programs to help alleviate poverty in the state. And I think we need people who are, again, compassionate about, not just compassionate about how we treat people. I don't know. Do you all know how many arrests we have by ICE in Baldwin County almost every month?
I would venture a lot because I consistently see people saying that they're raiding places.
So it's between 250 and 300 arrests every month in Baldwin County, which is one of the highest in the whole country, not just in the state of Alabama, but so we're not talking about criminals that, have done things or whatever. We're talking about families, hardworking young men and women who are who are raising money for their families, who are actually going through, in many cases, are going through the proper process of getting documentation. But for some reason, in one case, the young lady, she had missed one meeting because she was in the hospital. She had got beaten up by her partner and was in the hospital. Got pulled over on a traffic stop. She was on a list because she missed a meeting. She's going through the process of getting her paperwork. She and her sister both were in that car. They lived in Pensacola, and you talked about Pensacola before. And they were driving through Baldwin County, going to Mobile to work. They got pulled over. Both of them, within weeks, were deported. That's not the biggest thing. The biggest thing is they were deported to Mexico, and they're Honduran. We kept all their paperwork, right? So they had issues trying to get to Honduras. She asked to take her 3-year-old child with her, and was denied, right? So that child had to stay with someone in Pensacola. Well, while she was there trying to get that child to her, the gentleman that she left the child with killed that 3-year-old child.
Oh my God.
So I was just at that funeral in Pensacola, probably 2 months ago now, maybe 2 months ago. If you've never been to a 3-year-old child or a child that small's funeral, that thing will rip your heart out of your chest, right? So So those type of stories, right? And I took one of my campaign staff. She works with the immigrant families here in Baldwin County when they run into these situations. So I took her over to the funeral, and that's one of the reasons I was there. But it just ripped my heart apart, right? But that's just one story of story after story. So if you don't have a leader with compassion who, before making decisions about policies, thinks about the consequences for the person on the ground, for the family on the ground, you're not having a good people in place that need to be in place. So I'm also, again, faith-based, right? I'm a minister in my church. Now, being a minister in my church doesn't mean that I'm always making decisions based on exactly what most people think is in the Bible. Because if you really read the Bible and start using it and start acting like Jesus, then we wouldn't be treating people like we've been treating them. We wouldn't be trying to cut off SNAP benefits for everyone that whatever. So I really base a lot of my decisions on those things, but I also feel like people should have their rights protected. And no matter who they are, no matter who they love, they should have their medical rights protected.
Let's pivot right there for a second.
Yeah.
So I am a lifelong Republican.
Okay.
Never have been a MAGA Republican. Never supported Trump during the first, second, or third run. Don't care. Wish they had put anybody else up. I was more of a Mitt Romney, Herman Cain, Ben Carson.
Yeah.
But they never put up my guy, ever. But that being said, and I'm willing to listen to the Democratic talking points, the social programs. You just said medical freedom, and I think that Republicans out there that are willing to listen to Democrats and not just say la la la, I love Trump too much, are worried about that medical freedom because the COVID-19 experience put such a sour taste in people's mouths about medical freedom. So what is your stance and thoughts on that?
Well, I mean, first of all, our country needs to fix our medical system, right? We have too many people that aren't covered, right? Alabama has at least 300,000 people who fall in that gap of they don't make enough money or they make too much money to be covered by Medicaid, but they don't make enough for medical coverage, right? My daughter, who's my oldest, she actually lives in another state who has expanded Medicaid, but there's still a gap, right? There's still loopholes. So she lost her Medicaid because she started working for Amazon, but then Amazon would never give her enough hours to be able to cover her medical coverage, right? They would keep her below a certain level. So this medication that she needs every day, she couldn't afford because she was in that gap, right? And we have many cases just like that here in Alabama. So we need to fix that program. We need to make sure that we get people in the get. And people talk about, and my Republican friends many times talk about veterans, right? And how they want to do things for veterans. But when you have rural hospitals closing all the time, veterans live in those areas and they depend on those rural hospitals, right? So when we don't expand Medicaid and don't keep those hospitals open, not only is it affecting the everyday person that's in that area, it also affects those veterans. So when we talk about veteran care, we have to look at it at the big picture, right? What are we talking about? Are we talking about medical? We're talking about another thing in Alabama is mental health coverage, right? Mental health care is at the bottom.
It's non-existent.
It's non-existent. Yeah, it's non-existent here in Alabama, right? So we need to fix that. We're so concerned about filling prisons, right? We have these new prisons being built, and we're concerned about filling them. But a third of those people that are in prison here in Alabama have mental health issues that should be getting help somewhere else, not in a particular prison. But absolutely, and when I talk about medical freedom, I'm talking about a freedom for a woman to be able to make a decision about her.
And so to that point, also, what I'm really talking to the point of is vaccine mandates, mask mandates, and not having the government tell us, hey, you have to do this, you have to put this in your body. I think that is what the right is soured on.
Yeah. Oh, absolutely. There's a lot of that. And thank you that, because COVID was, one that had a lot to do with it. But in certain occupations, I don't know if you saw this story about, because they wiped out the vaccination requirements for the military. Here recently, 160 Air Force airmen got the flu in San Antonio because they took away the flu vaccine. Now, I took the flu vaccine from 17 years old because it was mandatory in the military. So I was used to taking it. I'm used to taking it. As a matter of fact, the first year I missed it, I got the flu and I thought I was dying. I was like, I have to be dying. They said, no, you have the flu. I was like, really? I thought I was dying. I mean, no, you have the flu. But they had to put that back in because the easiest way to destroy a fighting force is for them to get sick and to pass it amongst each other, right? That's one of the easiest ways. So that's one of those things. It's one of those occupations. I think there needs to be some type of guidelines on that. But yeah, of course, with COVID, many people didn't want to take the vaccine, which is fine. But I think that being said, I think that extended some of the things that we had to go through that people didn't take it. But again, that's freedom. That's medical freedom, right? To make a decision.
I was denied food in New Orleans because I didn't have a vaccine passport. I couldn't go get food from a restaurant when I was hungry. Yeah, and they treated us like dogs.
Yeah. Well,
made us sit outside and
I spent a lot of time in New Orleans, so I know what you mean. I had my passport with me, but I know what you mean. I saw people get denied to be able to come in, but again, when you're dealing with armed forces, it's different, I think, than dealing with
I think we can compartmentalize that as a separate.
It's a separate issue, but yeah. So that's medical freedom too, right? Being able to make decisions for yourself. But again, our government, they decide on one thing, but then they don't decide. I mean, they make a decision on one aspect of medical freedom, and then the other one, they're like, oh, no. So vaccines, no. But, these other things that, we need to do. So
right, your body, your choice for the vaccines, but not for women's rights.
Right. I mean, we're picking and choosing which one. We have people. I just saw a story. A young lady in Texas. She was having problems with her birth, and her doctor told her, if you go through with this, you'll probably die. But I can't do anything for you. You have to leave the state in order to get that taken care of.
Yeah.
Now, you're putting, someone in for me, being pro-life means you care about the mother, you care about the baby, you care about the baby and the mother before the baby's born, you care about after the baby's born, you care about them and their education, you care about taking care of them, in one way or another. You care about them. You care about the school to prison pipeline, right? You care about taking care of folks. You care more about investing money in programs to keep people out of prison than you do about building prisons, right? So that, to me, being pro-life is all of those things combined. If you don't care about anything else other than the birth, you're pro-birth. You're not pro-life as far as I'm concerned.
So talking more about the healthcare issue in Alabama as a state, I know you're running for a federal office, but, we want some of those funds, I guess, in Alabama specifically because I think we are one of the worst states for healthcare, exactly like you were saying. So, I'm from Florida and I still have to drive to Florida. I have an autoimmune disease and my medicine is like thousands a month. I don't have any insurance. So I get it through the manufacturer of the drug just on the off chance that I got like a special program pass that I had to fight tooth and nail for like 2 years to get the drugs so I could even walk. And then I had to have surgery and I had to go to New Orleans to get that, to have a cancerous tumor taken out because it was going to be $12,000-$15,000 here.
Right.
So I had to go to Louisiana and paid out of pocket $5,000 to get it.
Mhm.
Like, it's crazy to me that going to another state is the option because you can't afford it where you live.
Absolutely, absolutely. I have a T-shirt that says where you live shouldn't determine if you live or die, right? And on the back it says expand Medicaid, but it's the front of it says where you live. So just like you said, I was actually on a nationwide call probably 2 weeks ago, and they were talking about medical coverage, and they gave an example of the worst medical coverage in the country. And unfortunately, they showed Alabama statistics. And now I'm on a call with national, call. Mm-hmm. And they use, and I was one of the few people from Alabama on the call, right? Because you had to type in the chat where you were from and this and then the other. Alabama was the example they gave of some of the worst medical coverage in the country. The other example that they gave was the worst mental health coverage in the country. And guess what? It was still Alabama. So they showed two different slides about the worst coverage in the country, and both of them were represented by the state of Alabama. They probably could have chose some other states, but they chose the one that had the lowest numbers. And it really drove it home to me, being, again, one of only 2 or 3 people on the call from the state of Alabama. And I'm like, we have to do better. Again, at the federal level, I intend to do all I can to make sure that we have the funds coming to the state to help supplement, to help these programs, to help, and it's not just rural hospitals. I don't know if you saw in the news, Jackson Hospital in Montgomery, one of the largest hospitals in the city, was on the verge of closing about a month ago, right?
Wow.
So you imagine how many people, this is one of the largest hospitals in a metropolitan city. How many people would be without healthcare if that or jobs, if that hospital would have closed, right? So it is essential that we fix our healthcare issues. Again, we need people in Washington, D.C. who care about, you have to have compassion to care if a person has medical coverage, if a person has enough money to put food on the table, right? There takes a certain level of compassion to be able to really care about those things. When you care about corporate interests, that's what you care about. You don't necessarily care. You might care that the pharmaceutical company gets the most profits they probably could get, right? But when you don't care if the pharmaceutical company gets all the profits they possibly can get, you care about taking care of people. That's who we need making decisions for us in Washington, D.C. And I think I'm that person.
So my question would be, outside of your nonprofit work, do you have any lived experience, or what would your lived experience be? What draws you to the kind of work that helps, people in poverty, that you want to improve our education and our, access to resources like healthcare, mental health care? I'm totally on board with all that because, I used to work for the sheriff in Escambia County. And when that happened, when Orange Beach was like shuttling home to Pensacola because we don't have a mental health facility or anything and I worked for the city of Pensacola for the homeless task force. And I saw firsthand for 2 years, there was a whole encampment under the interstate and we had to move people out, find housing. And we saw a real epidemic going on that the city had to jump in as an entity and try to alleviate a lot of the housing crisis going on. And, I think people talk about it on both sides about how they care about it, but has it actually ever affected them in a way? I feel like it's all talk. So I guess my question would be, what leads you to care, outside of, I guess, given the experiences that kind of make that important to you?
Thank you. Well, part of it is I live off of military retirement and disability, right? So I'm with the people that are going through those things, right? Many people are 2 bad decisions away from being unhoused and being one of those people. So I feel like I'm close to the way they feel and the way they understand. I have spent a lot of time in New Orleans. I have talked to a lot of people who are unhoused and dealt with people, even here. And I don't know if they used to have an ordinance in Baldwin County. I think it might have been fixed by now, but that you couldn't build another homeless shelter, here in Baldwin. You couldn't have one. They had a one for family and they had one for abused women. But if you weren't in those two categories, you were shipped to Mobile. And then in some cases shipped to, if you were on the other part of the county, you were shipped over to Pensacola. But we used to drop people off, this county used to drop people off in Mobile all the time, right? Who were in house. So I feel like I have a close understanding of what people go through and dealing with the church, right? We give out food twice a month at my church, right? The line is growing, right? The line is getting longer and longer. Every second and fourth Tuesday, we give out food at our church. When you talk to these people that are getting, and these people they're not lazy. They're not just, they're not just looking for a handout, but they need help to make ends meet. They need help to be able to have food for their family for the rest of the month, right? Mm-hmm. So I deal with that all the time, and it's not just my nonprofit. It's also dealing with the church, and understanding what people are going through. So I feel like I have a close contact and understanding of what people are going through. I grew up, in a rural area. We didn't have much, but we didn't know we didn't have much because everybody had the same, right? So a lot of that plays into that my upbringing plays into how I look at things now. But again, we didn't have much, but we didn't know. Everybody took care of each other, and we always ate, so we were fine. But hopefully that helps.
Yeah.
Some what you got.
I wanted to ask you about two kind of hot button issues right now before we run out of time, because people really want to know how you feel about data centers, and they want to know about flock cameras. Those are the issues of the week. So what are your
data
thoughts?
Centers? I think we need a moratorium on data centers until we have more federal regulations, EPA studies, understand exactly how it's going to affect our environment, how it's going to affect the area. So I know Tommy Tuberville, he's all for it. I think we need to stop until we figure out exactly what effects it has. Even working in the chemical industry, of course, I worked at a chemical plant, but we were self-contained, right? We had water processing on the plant, right? We had all those things, the power generation, we had all those things. So we weren't passing costs on to anyone in the community. We weren't polluting anything. And we were away from neighborhoods, right? Right now, there are no regulations keeping those data centers from being in your backyard. Right? So they could be humming right there in your backyard, all the generators, everything else, because there are no regulations preventing that to happen. So we need to have a moratorium until we get those things worked out. And the other one was
Block cameras.
Oh no, we need to get. And I just read something this morning about that. Baldwin County has way more flock cameras than Mobile.
Mm-hmm.
Wow.
Which is crazy.
Guessed.
Yeah, that's crazy.
They're mostly here in Orange Beach and Gulf Shores.
Yeah.
There's like a little heat map.
Yeah. And that's what I saw this morning, I think, the heat map. So we have way more cameras here. They're evasive. They invasive. We don't need to have it. It's Big Brother spying on us and everything. And people talk about, they don't want government involved in this and that and the other, but then they turn around and back things like this, right? Like these block cameras. And so again, I am definitely not for those. They're not really helping with anything other than spying on people and as far as I'm concerned.
Yeah, I saw a news story out of Colorado that a resident had the police come and say that they were under arrest for stealing a package, and that they saw their vehicle going through the neighborhood and saw what they thought was this person on the camera, and it was not.
It was not.
And this person happened to have more cameras than the government did to prove their case, but it took almost an act of Congress to be able to lay out their own evidence, and they were guilty before proven innocent.
Absolutely, absolutely, and that's something, and it could be. I mean, it could be even fatal. Like you talk about someone getting arrested, but it could be someone actually getting killed because of something, a misidentification.
Just a matter of time. Yeah.
Yeah. So, no, I'm not for either,
I'd
either
like
one
to-
of those.
I like to take it farther and get rid of all the red light cameras too while we're at it. That's me.
They might be here to stay. I don't know. And we don't have, I don't think we have as many, and which amazes me that before getting those, we're getting this flock cameras, right? So, I lived in Europe, years ago, and they, of course, they had cameras taking pictures of people speeding and all, which I didn't like because you could be doing 1 kilometer over the speed limit, and the camera's going to take your picture because you were going over the speed limit, and then they would send it to you in the mail.
Mm-hmm.
I was like, oh my goodness, man!
Right.
I was like,
Yeah, human police will allow 10 over a lot of the time.
yeah. So I didn't appreciate that too much, but again, years ago they were doing that, but yeah, absolutely, I'm not for either one of those.
So, in a nutshell, what would your top priorities be for the first congressional district? And after that, tell people what they can do to where they can find you out online,
Okay,
how they can
sure,
support
sure.
you.
Sure, yeah. So my top priorities are medical healthcare, really, number one. Healthcare, we need to fix our healthcare system. Congressional District 1 is no different than any other congressional district. We're all are running into these issues with our healthcare. Affordability. I mean, and you all live here. You live down here. You know how gas prices are, how housing prices are. Home insurance prices have skyrocketed. My home insurance at my house, all the way in Daphne. So I'm a long ways from but I'm below I-10. It tripled last year.
Wow.
So bringing down costs and affordability, and then really immigration reform, right? We've had migrant workers in Baldwin County as long as there's been Baldwin County. But now we have people that are scared to come out of their house. We have people that are, we need to fix the system, right? I'm all for law and order. I am, some of the myths about Democratic candidates, you're not for law and order. You're not, what else is there?
Anti-police.
Anti-police, right? I am not anti-police at all. As a matter of fact, when I wanted to be in law enforcement when I first came out of school, but I went into the Army instead. But, I am pro law and order. I am pro people, police protecting and serving, right? The serving part is not really, the protecting and the serving is not where it should be right now. But I am. And if people break the law, they need to be arrested. If they break the law, they need to be arrested. They need to be. And it doesn't matter if they're undocumented or a U.S. citizen. If they break the law, they need to be arrested. So we need to fix that system right now. Speaking of law enforcement, this is just a Black history fact, so you know. My cousin James Granville Charity was the first Black deputy sheriff in the state of Alabama. So in Tuskegee in 1963. So you can imagine what he went through, right? In 1963. So again, I am pro law enforcement. And people will come at me and say I'm not, but because I'm a Democrat. Again, look, I'm pro military. I'm pro taking care of veterans. Veterans are extremely important. We have a lot of veterans that live in this area. A lot of veterans that live in Congressional District 1. We want to make sure they have everything that they need because they sacrifice years of their life for this country. We want to make sure that they're taken care of. So I'm certainly want to do that.
Yeah, I've heard VA reform brought up a lot in this cycle.
Yeah. Oh, absolutely. Yeah, absolutely. So, we need to fix those systems. And then last but not least, I am the Democratic nominee for First Congressional District. You can find my website at ClydeForCongress.com. You can donate, you can volunteer. You can see what my platform is. You can see what events we have coming up. If you want to schedule an event and hold an event so I can come talk to some of your friends and meet you face to face, please do so. Again, we're excited to have the opportunity to represent First Congressional District, and we're looking forward to being your representative in Washington, D.C.
Awesome. Thank you so much for coming.
Thank you for having me.
Best of luck at your election in November.
Appreciate you. Thank you so much.